Here's something we haven't seen in a while. Dr. Mike is making laps. On this morning's Ask Dr. Mike, I'm going to have to paraphrase because this was a comment from Anne Marie. And Anne Marie, for those of you that have not heard her story, has one of those truly tragic stories, especially as far as people not helping her. Anyway, she asks a legitimate question that I felt like deserved a decent answer. And she asked, hey, Dr. Mike, how come more primary care don't manage pain? You manage pain. What's their excuse? I'm paraphrasing. Okay. There's a lot of different things that go into this. And I'm going to try and kind of go down a list. But with my ADD, it's not gonna sound like a list, but in my mind it'll be a list. All right, let's talk about first how everybody shares information with the DEA, but no one shares information with PCPs. So one of the things that pharmacies are required to do is share all of their controlled medication dispensing to the DEA, and to not only to the DEA, but to medication wholesalers. Now you might think, why in the world? This is the stuff that truly is oppressive and is absolutely interfering with care. Okay, and the problem with it is not that the information is shared, but how the information is used. No big surprise. One of the ways that the information is used is the DEA is hunting for primary care providers whose opioid and controlled med prescribing falls within a certain number of standard deviations out of the average of all primary care prescribers. And of course, you'll never know until they knock on your door if they consider you too much of an outlier. You'll never know. So a lot of PCPs are very afraid of this list, with good reason. Now, we compound that by the fact that everybody that's listed as a PCP is in this average percentage, except that corporate PCPs in my area, the Atriums, the Novants, the Cone Healthcare, those corporate, UNC Healthcare to a much lesser degree, but those corporate PCPs are by and large not allowed to manage chronic controlled meds. Corporate primary care providers make up at least 80% of all primary care in the United States. And yes, that was an absolutely made up number that I think is pretty damn close to being true. If you just look at my geographical area and kind of spread it across the United States, I'm sure in some areas that number is closer to, 90%. And I'm sure some areas maybe it's less. But my point being is, and all of these PCPs are not allowed to routinely write for these controlled meds, because what is the function of a corporate primary care provider? A corporate primary care provider serves one main function. They provide referrals to all of the higher paid specialists within the corporate network. Okay? That's their main job. Guess who's one of the highest paid specialists in the corporate network? Interventional pain. You see how you following the dollars here? So remember, going back to the first point, because I'm combining 1 and 2 here, PCPs can end up on this list that the DA is watching and trying to find fault with. And 80% of primary care providers are effectively in the mix as far as determining the average, but not allowed to write controlled meds. So my point is, you can see that it is not very hard at all to be considered an outlier. It is not very hard at all for them to all of a sudden be heavily scrutinizing every prescription that you write. And if you are an independent like we are, that level of scrutiny only increases because, by and large, independents, because they want to take care of all of their patients' needs, and they don't have a gun being pointed at their head by corporate medicine that you must refer all of these problems out. They tend to manage what I call the throwaway patients. They manage the sickest, most medically complex. You don't think corporate medicine cherry picks? I'm here to tell you that they do. Okay? So we independents manage the sickest, most medically complex, and I'm air quote here because you know how much I love you, the drains on the system that corporate medicine has effectively dismissed in one fashion or another. And we, in our good nature and the fact that we are doing this because we have a calling, we naturally collect all of these throwaway patients. These patients usually need controlled meds for one reason or another. There we go. You see how we just by the very nature of the way we practice, that puts us immediately in the top 25th percentile of people who prescribe controlled meds. It is a continually disconcerting place to be. And I don't blame other PCPs if they're a little bit afraid when all the math is so obviously against us. You know, private practice is literally the safety net for the largest percentage of at-risk patients. We're the ones who don't capitate Medicaid, okay? We don't capitate any insurance. Whatever walks through the door, that's the insurance that we take. And because we don't do anything to shield us from these throwaway patients, where do they go? They go to the only place that they can go. They go here. And so, while I completely believe 80% of chronic pain ought to be managed in primary care, there is every rule currently being enforced. This is everything Miss Morandi is. Y'all, if you wanted me to make Miss Morandi's whole platform in what is now so far 8.5 minutes, I'm doing it right now. This is why Miss Morandi has to do all that she does. This is why there is a doctor-patient forum. Because bless God, there's got to be a place for the throwaway patients to go. And dadgummit, I'm glad that I'm one of them. I'm glad that I'm one of them. But in answer to the question, when you consider all of these layered upon layered upon layered risks, is it truly baffling that most PCPs do not write controlled meds? Is it really that hard to understand? That's what I said in my video yesterday on the one lady. She doesn't realize how awkward of a situation she created by the assumption that PCP could just manage it. It's not that simple, but it ought to be. Let me say that again outside of the sunlight. It's not that simple, but it ought to be. I love y'all. No buts. This is a long one, but bless God, I hope you hung out because it's worth it. Love y'all. No buts.